if you would bring your guest, Miss Barbara.
Good morning, everyone.
Good morning.
Let's see, I'm in Northwest Detroit. Let's see. So I used to say Lasher, but I moved to Southfield, so I say Lasser now. So I get it. I can relate definitely. But I'm a long-term resident of this Metro Detroit area, native Detroiter, through the DPS school system, and so proud Renaissance graduate. So I'm very pleased to be here with you this morning, and I'm very glad to be a part of our partnership with the NAACP. And again, it focuses on healthy, active lifestyles, and I really appreciate the conversation around understanding health from a holistic perspective, because that's so critical. Because if you're not secure in where you are as an individual, in your economic status, in the well-being of your family, accomplishing health is quite a struggle. So I think down the road, as we go through this partnership, we're going to get to that point where we're able to help people holistically. But also at the same time, we really need to focus on getting people physically active, because you have to get up and get moving. If it's just driving to a mall somewhere and walking around, we have to always encourage people to take those steps. Also, the importance of understanding and knowing what eating nutritiously mean. And so we want to take some steps over the next year to help people really understand that and make that a part of their everyday lives. And the third thing we're focusing on through our partnership is the prevention and the management of chronic diseases. We've all heard the statistics many, many times before, and we know that chronic diseases impact our community. When you look at diabetes, the rates are like 2 to 3 times more for African Americans. When you look at infant mortality even, it's 3 times more in the Detroit community where you have infant mortality. So it's creating that awareness, getting people engaged and involved in, I guess I can use the word taking control of their health, even though I really don't like to say that, but it really is about taking control of your health and empowering each other to do that. So with a focus on the prevention, I have with me today Barbara Exridge, and she already stole all my thunder. So she's a 26-year cancer survivor, which I think is just significant. But we had a little conversation as we started talking today. And so the first thing I asked her, I said, was it because of stress? And she says that's the first thing that her physician asked her, are you dealing with a lot of stress? And stress is something that we take for granted. And I told her yesterday I was feeling stressed out, so I drove home from work. I got home, took my clothes off, got in the bed, and took a nap. Because that was something I needed to do to regain my balance, to release all of the stuff that was going on at work, so I can be at peace, so I can be calm, so I wouldn't have all of this in my body. And again, it's about that holistic view of health and understanding what kind of strategies, what kind of things, simple things that we can do to empower ourselves to have a healthier lifestyle. So that's just one thing that I do. But I think it was just, really good that we had that conversation. So Barbara is a community outreach and recruitment specialist, and she's with the Wayne County Breast and Cervical Cancer Control Program. In the community, it goes by BC3P. And the need is to get information out about this program. It's a free program for people who are uninsured or underinsured, meaning that they may have insurance coverage, but they may not have enough coverage to get all of the care that they need, especially if they're diagnosed with having cancer. So Barbara's going to tell us more about this program. And as we move through this year, also I did not mention that I want to be able to bring information to you so you can take it back into the community and share that. Because one thing I've learned, I've worked in the community and healthcare for over 20 years. And the same problem remains today as it was 20 years ago, and actually as it was 50 years ago. There's a lack of information there's a lack of information for people in the community who really need it. So it's up to us to constantly share what we know and help people get access to the resources that are out there. So without further ado, Barbara, thank you so much for coming out. And she said, my boss just told me to be here. And so I appreciate it.
You know, I talk a lot, so pull my coat.
Okay.
First, I'm going to back up a little bit and talk about stress. And I'm going to tell my age. I started to work for what used to be called MBD in 1967. That's where my stress began. There was only 2 African American women in the department I was in. I had a young man, if one got a telephone, he said, hey, you have a call. He called you, hey. He would go by me and hang his coat up every day, every single day, and I would say, good morning, Melvin. He would go, But I broke him. One morning he said, good morning, Barbara. That's only the beginning. Hundreds of stories since 1967, NBD, all the way through, and how you had to fight as African American women. You had to be the very best at all times. You had to outdo everybody. And that was my mission then. Now I'm going to talk about the program. It's the Breast and Cervical Cancer Control Program for Wayne County, but we service Wayne, Oakland, and Macomb County. Recruitment specialists, what I do is grassroots. We go into the community, and we try to find a place where most women gather. It's only a few of us out there. We need more people with those boots on out in the community. We go to places like Kmart, which now you know there's no Kmart in Detroit anymore, not even Oak Park. The one on Telegraph closed, the one on Oak Park, we consider our store for Detroit. It's all gone. We go to DTE, Focus Hope, shelters, wherever they let us come and talk, churches, health fairs, but we need everybody's help to get the word out. The program, if you are between 40 and 64 with health insurance that's underinsured, meaning they won't cover diagnostic tests for the breast or cervix, we can step in now and help them. If they're without health insurance, we want to find them. We want to get them screened. And with our program, they can get a breast exam, a clinical breast exam, an actual doctor or nurse practitioner to give them a physical breast exam. We provide mammograms for them, pap smears for them, treatment, diagnostic tests if they need it, and follow-up. By mean treatment, through the state of Michigan, the Wayne County program, we have the ability to get them under the Medicaid Treatment Act right away. They don't have to go to DHS, they don't have to go anywhere but to our office. We get them started at treatment as soon as possible. The problem is we can't find all the women we need. They're falling through the cracks. These are the ladies that go to the free clinics. Maybe they do their grocery shopping at this little store on the corner with their bridge cards and paying too much money. That's a whole nother subject. These are the ladies that we can't find. So we need this information to go to everybody's neighborhood, block clubs, churches. And I was speaking to Bridget about how proud, and then another thing, we're very proud women, to tell you the truth. A lot of times we're at church and we won't let anybody know. You're sitting next to someone who does not have health insurance. I know the Affordable Care Act came into being. Some women took it out, but they found out premiums are too high, so they dropped it. They'll probably pick it up in the next enrollment period, when taxes aren't going to be, but they're going to be affected by their taxes. There are women that are too proud to ask for help, believe it or not. And often, I was telling Bridget too about how women sort of put ourselves on a back burner, gentlemen. And somehow we've lost the purpose that thinking about ourselves, that we are important, that sometimes we have to take a little time out for ourselves, not for the kids, the grandkids, the husbands, the aunts, the parents, and we're steady going down. So in the community, we try to encourage them that it's all right to take care of yourself first. It might take a day if you can schedule all your appointments at one time. So we need the message to go out in the community, and with that, we need your help. I'm going to leave some flyers in the lobby. Bridget's going to go get some more out of the car. It's going to say BCCP. Our phone number's on the bottom. All they have to do is call us. And we send them to places in their neighborhood. They are not hole in the walls. We have Providence, St. John's, and now Beaumont also participate with us. So they don't have to feel we're going to put a stamp on their head and say it's free. We give them a little postcard. They take it with their ID and they hand it when the lady calls them to the window, and that's it. Henry Ford Hospital, they serve our patients. So we want people to know that we're there for them, but we need your help. We need to get it to every place possible. Yes, Bridget?
Is transportation sometimes provided?
Yes. If they let us know they need transportation, we can provide that for them. But myself, when I'm out in the community, if they start giving me excuses, I say, what bus line you live near? Well, what bus runs by you? And I'll find a clinic that's on their way. We try to get rid of all those excuses because we can come up with some. So basically, we need your help. And that's what we're here for. That's our mission. Thank you. That's it.